State health leaders say minorities are disproportionately affected by the coronavirus and should take the vaccine to prevent it. WTVA's Wayne Herford joins us live from the North Mississippi Medical Center in Tupelo, where he talked to two doctors who agree and are urging everyone to get the vaccine.
That's right, Emily. Doctors Vernon Rayford and Jeremy Blanchard say that people of all races need to take the vaccine, the coronavirus vaccines that are available right now. But they admit for minorities, it's especially important.
It's been pretty consistent that if you give it an opportunity, it will spread. And if it spreads, it will cause hospitalizations and disability and death.
Dr. Vernon Rayford is a medical doctor in Tupelo. He is urging everyone to take the vaccine because he says even if one community is showing more cases right now, it will eventually spread to all communities.
It's important for everyone, black, white, to do those things to prevent the virus, because with something that's contagious, we can't keep the virus out of each community. So there's no way to keep the virus out the black community if it's in the white community. There's no way to keep it out of the white community if it's running rampant in the black community.
Dr. Jeremy Blanchard says that getting the message out right now is essential if the nation and the world are to overcome the pandemic. He says interpreting the information that they have is a challenge as well.
But this is what I know, is we're having a hard time getting it to the rural populations. We're having a harder time getting it to the African American populations and to the Hispanic and Latino. And it's hard to tell with the Asian because it's a very small number. But I suspect that we're having a hard time with that, and we're having a really hard time getting it to the socioeconomically challenged. Part of that.
Now, Dr. Blanchard went on to say that it's all about access. That's really a big problem, he says, right now for minorities and other people who are poor and don't have access to things like telephones and computers right now. That's because they have to use those to sign up to get the vaccine online. Both he and Dr. Rayford believe that it's important that the absolute best ways to reach the groups that need to be helped the most is by way of these computers and phones, as I just mentioned. Reporting live here in Tupelo, I'm Wayne Herford, WTVA 9 News.